Hello everyone, thank you for tuning in to my YouTube channel. I just wanted to talk about pregnancy, personally my pregnancy and what happened to where I got from being pregnant, giving birth to having to have surgery. Also, whoever is watching my video and you're wondering why my face is so fat, like the cheeks, and you can tell it's because I had a recent hospital stay for over a month and they put me on a high dosage of steroids. And so with steroids, your face can blow up, you can break out. So that's why my face is so fat. Compared to this, it's a big difference. But as soon as they taper down on the prednisone, which is a steroid I have to take, definitely my face would get back down slim to this. Okay, so let's get started. So for me, I conceived my son when I was 27. I had him when I was 28, June the 26th, 2014. And so, like I said, throughout my pregnancy, I was healthy. I was still working full-time at the post office. I was on light duty. I wasn't doing like walking up and down steps. I was doing like apartment buildings and stuff like that. But pretty much I was fit. Went to all my doctor's appointments. They didn't detect anything wrong with my heart, with any of my organs, with anything wrong with my son. He was a healthy baby. I was healthy. And so basically 3 weeks after having my son, he was 3 weeks old, I started feeling like shortness of breath, feeling fatigue. I didn't gain any weight during my pregnancy. I was still able to fit my clothes that I wore before I got pregnant. So, yeah, I didn't have any issues with swelling throughout my body or anything. And so because and also I was moving at the time after having my son as well, which I probably should have, I guess, got some recuperated from pregnancy, just having my body go through, that big change, the strain that that childbirth put on your body. So yeah, but still after that, I was feeling shortness of breath, and what else did I have? Like swelling? No swelling. And just feeling tired, fatigue, couldn't lay flat. Because if I tried to lay flat, it would feel like it was a ton of bricks on my chest. So I actually had made an appointment with urgent care to go in the next morning. So this particular night, it started feeling worse when I tried to lay flat. And so I had to prop myself up on pillows. So once I did that, it was still like me feeling like me walking to the bathroom, shortness of breath. I just knew it wasn't normal. And I knew that I had to go in sooner than what I expected. So I ended up taking my son with me. He came with me. And they ran all these tests. They did a EKG, an echocardiogram, and what else? They took blood work. And so I'm thinking, okay, it's nothing serious. Like, oh, and they did an x-ray as well. And I think they did a CT scan, if I'm not mistaken. But for me, I was like, oh, it's nothing serious. I'm going to come back home. Everything is going to be fine. Then when the doctor came in and told me, like, something is going on with your heart. Like, your heart is not beating normal. We see fluid around your lungs, and we need to transport you to Washington Hospital Center. So I'm like, oh my God, like, what am I going to do right now? It's like I have my 3-week-old son with me, and I'm calling family, and they're like, oh, I can't make it right now. Okay. They don't understand the severity of the situation that's going on. I couldn't even get my head around it at the time, to be honest with you. And so I ended up calling one of my friend's sister, and like an angel, she came through to the hospital, and she ended up taking my son for me and dropped him off at my sister's house. And I don't want to give her name, but she was an angel, and I appreciate just that gesture of caring that she showed me, and she didn't even hesitate. And so I'm forever grateful to, she know who she is if she watched this video. And so even the doctor, when I went to urgent care at Kaiser, I will always remember him because he was just so understanding. And he was like, I really need you to go to the hospital. I will, stay here with your son until your sister or someone can go pick him up. But I don't want you to leave and drive to take your son back home. So he was very sweet, very understanding. He cared about my well-being. And so I'm forever grateful for him as well. Because you don't find too many doctors who actually care on a personal level. They're there to do their job, diagnose, get you the treatment that you need to get, but really not understanding how you're feeling and what you are, like I said, experiencing at that time. So with that being said, I got transported to Washington Hospital Center. I'm still like, maybe I could still go back home. So they did an echocardiogram on me, and I was not leaving. My heart was not functioning properly. The echocardiogram, my heart was functioning like at probably 35%. And so I was not leaving the hospital. And I ended up staying at Washington Hospital Center, being admitted. First it was like a week, and they sent me home on these heart medications to see if that would help to repair my heart, to get it to the left side to beat properly again. And but the medications they sent me on didn't work. I ended up going right back to the hospital. Then they tried the IV medication for my heart, and that didn't work either. And so all this time is like, I'm praying, my family's praying, I'm feeling fearful, I want to say, because your heart, like, you need your heart to survive. And so me knowing that a vital part of my body, like this vital organ that I was born with, is no longer working properly, and all the drugs that they are trying is not helping my heart pump blood through my body adequately. So I was depressed. I was mad. I was like, why me? what did I do to deserve this? I was also saying, like, you know, God, I don't want to die. My son is only, like, at this time, he was like a month old. Like, he needs his mother. So, with that being said, they couldn't figure out what was actually going on. They knew, okay, my heart was weakened, but they didn't have a name specifically for my diagnosis at first. So they did their research and did, and that's when they came up with the postpartum cardiomyopathy. And so when they came up with that diagnosis, the only other thing they could do to treat me was to give me heart surgery and implant a device called a LVAD. And that would basically help my heart recover, the left side of my heart recover, give it a rest so it won't have to do all the pumping on its own. So this device, LVAD, would pump the blood through my body to help me breathe, to help blood flow go through my body. And so I remember the doctor who was going to perform my surgery, he came in. So the day before, they told me basically, okay, we're diagnosing you with postpartum cardiomyopathy. And so basically they explained to me what it was. They said the options are, you know, you may have to have surgery. And so I'm like, okay. I never had a major surgery before. Never in my life have I ever had to go to the hospital, have any type of major surgery. And so hearing like, okay, they're going to operate on my heart to attach this device, it's scary. You think, what if I don't wake up? What if I just don't make, like, it's so many things that went through my head that I was just like, I was scared. So the next day, the surgeon come in and, you know, they have to get my signature and have to go over the procedure, the operation, like what basically is going to take place, how long it's going to take. And so he's saying all this stuff and I'm just like, surgery? And he's saying surgery is going to be tomorrow. Now, imagine going from, okay, being perfectly healthy before my pregnancy, during my pregnancy, then getting hit with the news of, oh, your heart is, your left side of your heart gave out. Your function, the functioning of your heart is at 35%, which is very bad. And so you hear that and you're like, you know, oh my God, like, am I going to make it? Then you go home, they send you home on medications to help with your heart and it's still not working, still out of breath, I still can't breathe. You got to go right back to the hospital, stay in the hospital, get IV medications that still is not helping my heart improve. And then explain like, okay, you may have to have surgery. To the next day, you're gonna have, so you need to have surgery, where we need to do this. This is the only way you will make it. Then it goes to, oh, and your surgery is going to be performed tomorrow. So imagine like all this going on, and this is just a lot. And then being a new mom, like I had postpartum depression. And so I still couldn't put my head around the whole situation. I'm just going with the flow. Like, this is what I need to do. Whatever needs to happen, I just need to be here for my son. And so I never took that time to really gasp, like to really take in the information and feel the emotions that I was supposed to feel. I had to keep that strong face. I had to be strong. And so that next day I remember waking up at probably like 5 a.m. and it was a sweet nurse. She was so nice, so kind. And I remember her, she was from Jamaica. And she prayed with me. And she knew I was nervous. She knew I was scared. And she was just like, you know, God got you in his hands. He's going to bring you through this surgery. You're going to be okay. You're going to go home after your surgery and you're going to be with your son. Just remember that God has you in his hands. And from that point, I was just like, let's just do it. Let's, you know. So, had my surgery. I was actually in the ICU. So, I don't know how many days exactly I was knocked out, but I know my family, they were telling me they was calling up there. They tried to come see me, but I was drugged up, you know. So I woke up with a breathing tube and, you know, I had to basically show them that I could breathe on my own. And I did that. I definitely had to do physical therapy. And, you know, I had mood swings while I was in the hospital. I was missing my son. I wasn't able to see him. I was in pain. My pain was managed. I say okay, but I was in pain. And I still was dealing with like feeling depressed. I was just not happy at all. Then on top of that, I had to learn how to operate this machine that was attached to my body. I actually, you could hear it, because it would make like a swooshing sound, or like, it sounded like a washer, and it was just constantly, and that's it, just turning, helping the blood flow. And so that was something I had to get used to. Also having a wire come out of my stomach that is plugged into a machine that I can carry in this, it was like a little carrying case that you put over your shoulder that I can carry in that, and it had 2 batteries attached to it. And so I had to get used to having this attached to me. I couldn't take baths. Baths was out of, it was not even in a thought. And so with that, it's just a lot of things that, you know, people take for granted, like being able to take a bath, being able to go swimming, go get on roller coasters, being able to do just the normal little simple things, like that was taken away, you know. And then it just made me appreciate life and just the simple things in life. It felt good because, okay, I'm still alive. I'm able to go home and be with my son. But also not just that, sometimes I would forget that the machine was attached to me and I would just get up and it'll snag. That would hurt so bad. So I did pretty good with the LVAD. They taught me how to clean the site, has to be sterile and things like that. So they definitely educated me on being clean, changing the site where the wire came out of my stomach, making sure I didn't have any infections, thank you God. And definitely I wasn't able to work, so I couldn't go back to work and at the post office. So I was out of work, which was something that I did not mind because I was able to stay home with my son and be with him. And also back to the mental health part, like going through any traumatic event, I encourage people to seek out a therapist, especially if you don't have someone you can talk to. Sometimes family don't understand what you're going through. And so sometimes they give their opinions and it makes you feel worse or it makes you angry because they don't know, because they're not in your shoes. And so you definitely want to have someone you can talk to. You don't necessarily have to talk to a therapist, but definitely have somebody you can talk to when you're feeling down. If that is not working and you need extra help, like clinical help, like you definitely should seek out a therapist. I did not do that. Not at first. I did not do that. That came later on down the line when I had got my heart transplant. But yeah, so I just encourage people to take care of your bodies. And in my case, it was nothing that I did wrong. It was just, it happened. And I definitely feel like the medical field should do more research on why this particular type of heart disease or heart disorder is happening to more younger women. It's happening more. And especially me being an African American female, they need to do more research on that. How are we more at risk for having this particular type of congestive heart failure? Because it's such a low percentage of people, of women who get it each year. I don't think they really look into the factors that are associated with postpartum cardiomyopathy. So yeah. And so if you guys have any questions about what an LVAD is, you have any questions about me during my pregnancy, or just any questions you have, please comment your questions below. If you just want to make a comment, put it below. And I'm just grateful that you guys tuned in, and have a blessed one. Please click on the like button, subscribe, and have a blessed day. Bye.